My name is Trevor Leong. I'm a radiation oncologist from the Peter MacCallum Cancer Centre in Melbourne. So I was talking today at ESTRO about the TOPGEAR trial, which is a randomised phase 3 trial comparing preoperative chemotherapy either with or without preoperative chemoradiation for patients with resectable gastric and gastroesophageal junction cancer. So the TOPGEAR trial is an important trial which really investigates the role of radiotherapy with gastric cancer. This has been a burning question for the last 20 years, and I think the TOPGEAR trial was a very large intergroup global trial which has answered that question. We reported the initial results at ESMO last year and published in the New England Journal of Medicine. The results showed that there was no survival benefit with the addition of radiotherapy. However, there was much better tumour downstaging with the addition of radiotherapy, with doubling of the pathological complete response rates. I think what the TOPGEAR data shows, together with the ESPEC data, is that patients with resectable esophageal and gastric cancer, there is probably not a substantial role for most patients at the moment, just given the large survival benefit with preoperative FLOT alone. However, given the high PCR rates and tumour downstaging, there are certainly areas where chemoradiation could be used. For example, patients who are not fit for FLOT, and we see those every day in clinic. FLOT is quite a toxic regimen, and for those who can't tolerate it, I think chemoradiation is a good treatment option. In the ESMO clinical practice guidelines, which we updated recently, we retain preoperative chemoradiation as a treatment option. Also, for patients who are not suitable for surgery, then we can use chemoradiation as definitive treatment with the aim of organ preservation. So TOPGEAR is an acronym which actually does relate to the trial. So if you look at the letters TOPGEAR, it stands for Trial of Preoperative Therapy for Gastric and Esophagogastric Adenocarcinoma.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.